All right, good morning, everyone. I'm Samantha Trotman-Berman, for those that don't know me already. And as I said at the beginning, if you missed it, we are going to be recording this. And what we'll do, I think, is keep questions to the end. And you can either do a hand up through Zoom if you're technically savvy, or throw your hand up. And there's also a chat feature as well. So thank you so much for joining us this morning for the first in what we're calling a two-part series addressing the issues of behavioral health during these uncertain times. I recently heard an author and a speaker, Mike Covino, say, if you had mental health issues before COVID, now they're worse. And if you didn't have any before COVID, you have them now. And I think that that has been, in my experience, quite true. We're going to hear today from a very special speaker regarding the need for behavioral health services and why it's necessary to work together to address those needs. And then if you could please mark your calendars for November 9th, it's going to be an evening meeting, 5 p.m. to 6 p.m. And in that meeting, we'll discuss behavioral health care now and in the future. And we'll have some staff from BILH and also BID Needham taking a look at what's available now and what we hope to be able to offer in the future at a local, state, and national level. I actually prefer to think of this conversation as much more of a starting point for something really big and special. The need for behavioral health services is just too great, and BID Needham is perfectly positioned to rethink behavioral health care in our community, just as it is rethinking physical health care in our community. So I'm going to speak for a minute, but just before that, unfortunately, John Fogarty sends his regrets and is not able to be here today with us, the president of BID Needham. He usually does a very brief hospital update, and Samantha Sherman, VP of Philanthropy, has offered to take his place. So over to you, Sam.
Thank you, Sam. Yes, I'm happy to fill in for John. He sends his regrets and wishes he could be part of the conversation today, but he'll be there on November 9th for part 2. The hospital is full. Our inpatient units, our ICU, our emergency department, we are at capacity. I'm happy to sort of let you know that volume has come back at the hospital. I know after our COVID days, we were a little worried whether people would return to the hospital. And actually right now we're seeing volume at probably 130 to 140% in some service lines over where it was pre-COVID. So the hospital is incredibly busy, inpatient, outpatient, emergency room. Today is particularly important because while this past year has really been marked by the pandemic and COVID, behavioral health has been really a constant for us and sort of escalating in terms of need. So pre-COVID days, as Sam had said, behavioral health was the largest unmet health need identified by our community. And we were starting to rethink how we address those needs in the community. With the onset of COVID and more recently with the closure of Norwood Hospital, we're seeing now in our emergency department 4 times as many behavioral health patients as we had previously. And so really there's been a huge shift at BID Needham in terms of the type of patients we're seeing and the increased need for care at the hospital. So this is an incredibly important conversation to have, not only just for the patients that we're seeing walk through our door, but like many of you, we're also looking at a workforce, our staff members who have been handed challenges day after day throughout 2020 and risen to the challenge. And we're talking about resilience training and stress management and dealing with their own personal anxieties or personal professional challenges brought on by COVID. And so we're really thinking about how do we keep our staff as healthy as possible in terms of physical and emotional wellness so that we can care for the community. So this is incredibly important. And I thank you, Sam, for putting together this 2-part series. And Nick, thank you again for joining us. I think this could be a yearly thing. We have you come in September and talk to us about what's happening that you're seeing from your seat. And I think it's important that we take this and that we have some, even even if it's small things, actionable things that we can do in our own lives to deal with this. But certainly we're relooking at it from an organizational standpoint.
Thanks very much, Sam, for that update. I really appreciate it. So I'm going to say a few words. Normally, I just introduce the speaker at this point, but as everybody I think on the call knows, this is a very personal topic for me. And so I'm typically moderating the speaker series as the chair of the Board of Advisors, the new chair of the Board of Advisors. But I'd like to briefly share with you why I'm so passionate about the need for behavioral health services in our state and in our community. And really, it's quite simple. I need them. My family needs them. Stepping back, I am extraordinarily fortunate. I have 4 physically healthy and spirited children. Spirited, by the way, I've learned is a PC term for very difficult kids that one day will make really cool adults. But joking aside, I am fortunate in many ways. I'm married to a great man. I have a wonderfully supportive family. I live in a beautiful home in Dover. I'm well educated, and between my husband and me, we've had good enough careers that we're financially well off. And all 4 of my children have anxiety. 2 of them have severe anxiety and depression. One of my kids tried to take her own life 3 times before the age of 6. Another was recently asked to leave her boarding school due to suicidal ideation. 2 of my kids suffer from NSSI, which is non-suicidal self-injury, which has really only emerged in the last 30 years as a very addictive, unhealthy coping mechanism. Less extreme, but still very impactful to our lives, and perhaps more relatable, we deal with school refusal, learning differences, social pragmatic issues, pure OCD, and phobias. I have some excellent local providers, some covered by insurance and some not. And we've also chosen to seek out-of-state residential treatment for 2 of my children, not covered by insurance. And we're struggling. In telling my story, I hope to highlight that behavioral and mental health issues do not discriminate. And remember, I am fortunate. I have resources, support, and connections. I know what happens to those people that don't have those advantages, and it's unacceptable. Dr. Covino may use the World Health Organization statistic that 1 in 5 people in the world are affected by mental health issues. But he and I both think that underrepresents the problem. In my case, the statistic is 6 out of 6. So I'm happy to answer questions along with the speaker at the end of our session today. But now I'd like to offer Dr. Nicholas Covino to put this all into context. I first met Nick when we were rehearsing our behavioral health panel discussion for the 2019 BID Needham annual meeting. After hearing my personal speaking piece, along the lines of what I just shared, he paused, thanked me for sharing my story, and invited me to reach out to him if he could be of any assistance. And by the way, I have at least 3 times since. So first and foremost, he's a really good human being. During his career in clinical practice as a psychologist, he has devoted his energy to helping patients. He was formerly the director of psychology and of training at the BID Medical Center. And since 2002, he has been the president of the William James College in Newton, and he is transforming the way that future mental health providers are taught to address increasingly diverse and complex issues in our communities. So it's my great pleasure to introduce you to Dr. Nicholas Covino.
Oh, thank you greatly, Samantha. I feel the same way this morning that I felt when you spoke the last time, and I heard this story, and I know your story. And not only am I moved by your honesty, but as somebody who's worked in mental health, the several of you on the panel on the screen know people just don't become advocates for mental health from their personal experience. We don't share the things about ourselves that feel in some way unfinished or challenging or embarrassing. I started a couple of years ago to share my brother's story. So my brother had a beautiful young boy named Nicholas also. And another day we can talk about drug use, but he died of a drug overdose. And it was a nightmare for him, my brother, and my sister-in-law to get the care that this boy needed. We just don't have it. We just don't have it. Despite our best efforts and intentions, it's almost impossible to get care for young people. 70% of moms and dads in Massachusetts that want to get mental health care for their kids cannot find care. And if you're a person of color, 90% of the time you're going to find somebody who looks like Samantha more than me, but you're going to find a Caucasian person to do it. So we're woefully in a spot of inadequacy about this. But what makes the change happen is people having the courage like you do to say, let me share my story and tell you about me without fear of being criticized, but because it needs to be changed. And you're a remarkable woman. You're a remarkable woman. And your mother would say that. And your mother would say that too. So let me begin. I've got a screen to share. Can I do that? Let me try. Let me see. Let me see if I can do it. So. All right, can everybody else just nod your head if you can see me?
We can
All right,
see
so I'm
you.
gonna hide you. I am, for today's program, also changing my name to Samantha, so that, so I'll blend in with the other Samanthas in leadership at the moment. I'll also say I'm trained as a psychoanalyst, and we probably won't talk too much about psychoanalysis in this presentation. There'll be a lot more behaviorism and cognitive behavioral work shared with you than psychoanalysis. But let me try to make a couple points, and then maybe we can have a discussion. Here are 3 points. First of all, as Samantha said, mental health problems are prevalent and they're consequential. Always, mental health problems are prevalent and they're consequential. Secondly, if you think that mental health is worse during this time of COVID, you're right. It's significantly worse. And thirdly, what I wanted to do, instead of giving you an ain't it awful talk, and I've given those and it always makes me depressed when I leave. So I was trying to make myself in a position to have a better day. Third point, you can do something about mental health, your own mental health, your family's mental health, but it takes intentionality and effort. You cannot wish to make it so. It really takes effort. And let me tell you a little bit about these things. So I gotta move you guys around because you are crowding my slides. So as Samantha said, in a normal time, I would say to you, 1 in 5 people, so about 20% of adults, same with kids, have a mental health problem, a diagnosable mental health problem. So depression, anxiety, substance use disorder, something like that. But half of us are going to have it in our lifetime. So cross-sectionally, looking at today, you might see 1 in 5. In a lifetime, you see 5 out of 10 of us will have some kind of significant episode of anxiety and depression. Second point, youth mental health is worsening, and it's getting to a very serious place about suicidality with young people. I'll tell you about in a second. But if you think that teenagers especially are experiencing increased episodes of depression, anxiety, more depression and anxiety than substance use disorders these days, you're right. And again, most of them don't get treated. Even the diagnosed cases do not get treated. About 60% of kids will not get the treatment that they are looking for. And in Massachusetts, a couple of years ago, the Blue Cross Blue Shield Foundation did a study and found that 50% of the adults that were actively seeking treatment for themselves, 50% could not find a provider because there just wasn't anybody around to see them, right? So we have a woefully inadequate mental health or behavioral health care system, woefully inadequate. And I will tell you, Massachusetts is one of the top 3 in the country, right? 50% of the counties in the country have nobody like me. 50% of the counties in the country have no mental health professional of any kind. No social worker, no licensed mental health counselor, no psychologist, no psychiatrist. They don't have anybody to deliver mental health care. And we've been overlooking this for years. We've got access to mental health care unless something happens in the next month. The Affordable Care Act provides payment for mental health services. So it's not like we can't afford to pay people, but we really just don't have enough providers to do the work. When mental health care does not get treated, it's impactful, right? So more than anything, I don't know if did I come to that slide yet? No, did I? Yeah. So just to pause for a second, Dr. Insel said some years ago when he was at the National Institute of Mental Health, the economic costs of untreated mental illness are going to be larger than cancer, diabetes, and all respiratory ailments put together, right? So it's not like, well, it's really important to treat heart disease, and so we build a big system for that. Or if I asked you, does anybody know the Joslin Diabetes Center or the Dana-Farber Cancer Institute, right, the Jimmy Fund? Everybody would raise their hand. Yes, we know the Jimmy Fund. 1 out of 330 children get cancer, but 2 out of 10 get mental illness. And we don't have a Jimmy Fund for mental health, all right? Consequences of that are that we've got an enormous problem with mental illness and substance abuse among the homeless population, right? So people are not homeless because they choose to be homeless. People are homeless because they are disabled in some way significantly by mental illness or substance use disorder that's untreated. 30% of the homeless population are veterans, right? Are veterans. 25% of the homeless population are under 18. If you look at our prison systems, people rightly say these are de facto mental health centers, prisons, because somewhere in the order of a third of imprisoned people have a diagnosable mental illness. This means wrong place, wrong time, bad judgments, bad choices, not really wickedly bad people that you need to lock away to keep us safe, right? But these are people with problems that we've brought treatment to. And 70% of the children, the young people under 18, 70% of those people in prison under 18 have a diagnosable mental illness, right? Another day, they'd be in a hospital. Another day, they'd be in a treatment facility. Another day, someone would be counseling them in school. And with schools, 50% of the kids that drop out of schools also have an untreated depression problem or anxiety. And this costs about $1 trillion or better to this country. It's really hard to estimate what the costs are of all of this, but it's probably more than $1 trillion, people say, to treat what is the biggest cause of disability in the world, but the biggest cause of disability in the country, which are mental health and behavioral health disorders. So this issue on normal times is a really, really, really impactful, serious issue. And again, people overlook it because they feel like it's not going to come to my house or to my kids, but it does, right? So if 4 out of 20 kids in a classroom, right, that's 1 out of 5. So 4 out of 20 children in the classroom, 4 out of 20 kids in a classroom, every classroom in the United States has a diagnosable mental illness. What kind of learning goes on in that space? Because it's not the 4 and 20, it's the other 16 that can't learn because there's a 4 and 20 blackbirds there in the space, right? And the teacher has to manage that group of folks, right? And we know that 50% of young teachers leave the field in 5 years, right? Because putting people into that situation is untenable for an idealistic young person who has to manage a group, right, in that space. So we've got some serious problems, not the least of which is suicide, which among young people is the third leading cause of death for 10 to 14-year-olds. Third leading cause of death, suicide, imagine that. Second leading cause of death, 15 to 24. And I'll tell you that now a recent study finds that young people say 8 to 24, so all young people, most young people, 25% of them have thought about suicide in the last month. 25%, right? These are your kids. These are not Samantha's kids, just. These are not my kid or my nephew, just, right? These are our kids. This is everybody that we are living with has a significant issue moving forward. And to the point I made earlier, if you think it's worse now, it is, right? So the CDC did a study in summertime in June, and they found that it's not 18% or 20% of Americans that report struggles with mental health or substance abuse disorder, but in this time of COVID, 40% are reporting that. 40% are reporting that. And so think about those kinds of surveys and studies, right? They're like polling studies that people do, seeing, are you going to vote for Trump or Biden? A certain number of people will tell you the truth, and a lot of people will lie, right? And they'll not respond, right? So imagine asking folks, do you have these symptoms, anxiety, trauma, PTSD, substance use, right? Imagine doing that at the Stop and Shop or Wake, right? How many people are going to tell you the truth, right? A lot of them won't tell you the truth, right? But 40% then probably is, as Samantha mentioned, a grossly underestimate of what it is that we're experiencing in this country at this point in time. 40%, that's a lot of folks, right? When you look at the symptoms of, let's just say, depression, right? People feel sad and pessimistic, they're fatigued, they have weight changes, they've got body aches, they've got suicidal thoughts, they've got sleep deprivation, they feel helpless. I'm going to come to that in a second, right? I think I've said to my staff and our folks, when people say, I'm feeling tired all of the time, I hear this from people. I'm tired of Zoom. I'm feeling tired. I don't think you're feeling tired. I think you've got a subclinical depression. I don't think this is fatigue. If it was fatigue and you slept a couple of hours on the weekend, you'd feel better. But I ain't feeling better. You know, I'm fatigued like that every night, right? And I've had 2 very lengthy psychoanalyses. My emotional, pretty accessible to me. But at night, I'm blue, sad, disconnected, looking for pleasures in my spaces where I don't have them anymore. I could sleep for 12 hours if you let me sleep for 12 hours on a given day. Fortunately, that didn't happen this morning, but it could be that it is the case, I think, that the 40%, 50% of this country has an untreated subclinical depressive syndrome. This is not just, I've got Zoom fatigued. There are some reasons for that. Let me share some of that with you. So here's where, please don't report me to the Boston Psychoanalytic Institute. I don't think there's anything in what I'm about to say that has anything to do with psychoanalysis. There might be, but there might be. I'll make it up a little bit just to make sure that I don't get kicked out. There are several theories on depression. We really do have some psychoanalytic theories. I'm not going to talk with you about those at the moment. I got to talk with you about really one important one. There's a biological theory of depression, right? People think there's an imbalance in neurotransmitters and medication helps that. I'm not going to talk about that either. But that's an area you know. I'm going to talk about really one, but I'll tell you 2 others on the way into that one. There's a long history of depression being triggered by separation and loss. So somebody needs to mute themselves that isn't muted. So take a look down, see if your microphone is muted. And if it isn't, can you do that? And if you're the controller, could you make sure that happens? Because I'm hearing people breathe. We are a human species that wants to be attached to each other. We like that. Babies require that. We learn about our emotions, ourselves, how to regulate our feelings, how to negotiate with other people by attachments that we have with people. We feel better when we're in the company of people that we love. We feel sad when they go away. Remember when your kids went off to college. Remember even the first day of school, how anxious you were, how sad you were when that little being went off to kindergarten or preschool and you were suddenly alone in that space. Remember when someone you loved died. Remember when you got divorced. Remember when you broke up with some, right? Human beings are built for attachment. Human beings regulate their emotions in relationship to each other. And when we don't have that kind of rich connection with human beings, we feel depleted, right? You see this in elderly people, especially. Theorists talk about that as conservation withdrawal. When people have lost so many, they don't attach to new people. They stay disconnected because the pain of that loss is so significant. We as a species don't want to continue to endure it, right? So on the downside, separation and loss creates grief, creates sadness, depletes us as human beings. Attachments fill us up, right? Look only to your own personal experience about holidays, birthdays, celebrations, the last time you met this person or that person, the last great social event you're at, right? It buoys us up. Those events buoys us up. Those relationships buoys us up. What's happening with COVID? We have to be 6 feet apart. We can't have Thanksgiving. When's the last time you kissed anybody that you weren't immediately attached to, right? Or hugged anybody that you immediately attached to, right? We're in a space, and it's not, we've been in that space for a week or two. Anybody can endure something like that for a week or two. We've been in this space for almost 9 months, where we are disconnected, depleted, and where we're looking ahead and we can't see attachments happening again. In fact, we're looking ahead, and Samantha tells us the hospitals are full again, right? The news is telling us we've got worse spikes of this coronavirus than we had at the beginning, right? Serious interpersonal distance and disconnection. Serious, everybody, not just 10%, not just 20%. Second thing that creates depression, there's a theoretical point of view that says, when you have pleasant events and experiences in your life that don't necessarily involve relationships. So think about the last time you took a hike in the woods. Think about the last time you sat in a hot tub. Think about the last time you went to a wine tasting by yourself. Pleasant events, right? Even if it's, buying a new pair of sneakers or running shoes, or pleasant events make us filled with relief and pleasure and satisfaction. When they're not there enough, we feel depleted, right? We feel depleted. It's almost like a hydraulic model, right? When you get a bunch of pleasant events and experiences happening in your life, you feel happy. So even just think about the last time you saw a great movie, went to a nice play, you leave that experience of the theater or the symphony feeling uplifted. You can feel your mood buoyed up, right? When was the last time we had pleasant events in this COVID environment, right? Can't go to the restaurants, can't gather in places, can't see this, can't do that, can't buy this, can't go here. And that's a real thing, I want to say. That's not a 20% thing, that's a 100% thing, right? We are all feeling that degree of lost pleasant events. Third thing that I want to spend a little bit more time with, because it's not that complicated, but it's impactful. Third theory about depression is learned helplessness, right? So you see the elephant. What do they do with elephants? People may know they chain them as baby elephants to a peg, right? And they cannot move when they're baby elephants. Then they get to be these huge behemoths. They chain them to the same little peg and they sit there. Now they could rip the peg out and half the ground out around them, but they have learned at a very early age that any agency on their part when they're chained to that peg is useless. They have no agency. They have no ability. They've learned to be helpless. Learned helplessness reaction is a quitting response that follows a belief that whatever you do doesn't matter. okay? So let me just tell you about this a bit. Seligman, who looks a little bit like Art Garfunkel, at least when he was doing these experiments in the 60s and 70s, doesn't look like that now because I know him. But he did a famous experiment with his partner and found that if you took a dog and you put him on a shock box, in a box, half of the grid was a grid that gave a shock, half of the grid was safe. It was not a space where you'd get a shock. You'd sound an alarm of some sort. It took about a trial or two where you'd sound the alarm and give the shock before the dog got the idea that they could jump the fence and be safe. And then they did. And then they got so good at that in just a few trials that they found whenever they shone the alarm, they wouldn't even start the shock. The dog would just jump and go to the other side, right? Everybody know that experiment, kind of, right? Then what did they do? They kept the dog from escaping by putting the wall up, right? And so then they'd sound the alarm or ring the bell, and the dog would go nuts trying to escape, bouncing off the walls, trying to escape, feeling agentic, feeling their agency, feeling their power, and then just discovering that there was nothing they could do to get out of that side of the box, and they had to take the shock. Eventually, after a few only trials like that, they'd sound the alarm, the dog wouldn't even try to fight. They'd just lay down like the dog on the right and whimper and take the shock. Even when the wall got put down and they could see that they could escape, they did not. The bell would ring, the light would go on, and they'd say, I'm gonna get shocked. They'd think, I'm just gonna lay here and think this bad thing's gonna happen to me, and there's nothing I can do about it. Everybody get that model, right? Not a hard model to understand. What then happens is a dog starts to make sense of that experience and say, this bad event's going to happen. I have nothing that I could do to make it better. It's always going to be like this, right? And all I can do is sit with the consequences of this. And Seligman called that learned helplessness. So a bad event happens to that person. They think it's permanent. They think it's far-reaching, and they think that it's because of them. I'm no longer agentic. I'm no longer able to make a change in my life. Think about the things we've experienced as human beings that are like that shock box, and we are like that dog, right? How agentic, how powerful, how capable, how helpful do we feel about this pandemic, right? It feels absolutely like it's beyond our control. It's unending. I mean, this is the longest except for the Vietnam War, which was unending or seemingly unending to me in my youth, but narrow in its impact. If you made it be, right? I could still go to school. I could still have friends. I could still grow up around that. But my little boy going through this is in a COVID spot. Can't play basketball, can't see his friends, can't date, can't go to the movies, and he feels as a young person, this is likely to last forever, right? Older folks among us know it won't, right? But it's how you put this picture together that matters, right? Think about what's happening with our elections. It's not just the strong feeling that you have about it. It's the idea now that's coming that no matter what so some of us felt like we've waited 3 years and 47 days, whatever it is, to vote, right? We're really looking to vote. And now we're told, maybe it's not gonna count. Maybe we're not gonna count it, right? Maybe I won't leave if you vote me. You know, this is not to get overly political, but these are the messages that we're hearing as human beings, right? Think about the issues of race in this country. Think about how Black and brown people feel as they're looking at George Floyd, and then it turns into this episode and that episode and another episode. They cry out for change around the police, but it doesn't come. There's another nightly story about some kid walking away, some person walking away, getting shot in the back, right? So the messages that people are getting, some people will get, are that nothing they do is anything they can have control over, right? So we are, as a group, as a unit, as all of us, hearing these messages of learned helplessness, right? So 2 pieces of hope I will tell you. First of all, how you relate to that learned helplessness experiment is dependent on how you understand that experiment. And the psychologists call that attribution theory. So it's not whether you win or lose, it's how you place the blame, they say, right? So the little boxes, I'll encourage you to learn more about it because there's material, lots of material out there about attribution theory, cognitive behavioral theory, to help you understand that when people look at bad events as temporary, isolated, and beyond their control, they feel more optimistic. I tell my son, I know this feels awful, Pete, but it will pass. You will get back to mountain biking. You will get back to basketball. It may not be in January, but you will have it. This will pass. And it's not your fault, right? It's happening because of a virus. But it's not gonna, and it is far reaching. It's happening to the whole world as we go along with it, but it's time limited. The time is just a lot longer than we expected that it would be. That point of view, when you can make yourself reason to that point of view, allows you to keep hold of your sense of hope and agency. When you think it's permanent, far reaching, and due to your own effort, you're gonna get pessimistic about it. So everybody see that? This is an experiment that's happening to all of us from a number of different places, but the way we think about the experiment is going to influence how we feel about it, right? I will tell you that this was not an easy thing for the dogs to learn. The dogs eventually learned that the shock box could be managed by their jumping over the little wall again, but they had to be dragged multiple times by the experimenter from the shock side to the non-shock side to learn that, right? This is really important. Change in learned helplessness experience requires you to drag yourself to the other side of the box. It doesn't happen automatically. It doesn't happen effortlessly. It doesn't even happen easily, right? Every single dog that learned how to escape the shock box had to be dragged from one side to the other. It varied how many times based on the dog and his or her history, right? But change requires effort in order to regain your sense of agency. Does everybody get that? That's really important, right? So when you think about managing emotions, this is a dog show this morning. That's not really me and my dog, but I needed to do some psychoanalytic something in here to keep my license. All right, so there are ways you can learn to manage this. I'll give you a couple and then we can talk a little bit more. There are 3. So looking backwards, thinking about the relationship issue, you really need to make a plan to be with somebody that you love, right? So Samantha brings her mother to this morning's meeting. That's a good thing for Samantha, and it's arguably a good thing for Samantha's mother to be present and connected. But you have to be intentional about it. You have to put the time into it. You have to think to do it. Most of us are not. Most of us are going through the week and the weekend and the week and the weekend and the week and the weekend. And we're not thinking about, have I seen Phil recently? Have I called Mary recently? How do I get together with somebody, maybe just for a drink in the outdoors with a mask? But it's really important that those relationships come back, and you need to be intentional about it. You need to make a plan. You need to do an analysis about who you've not seen, what you can do, how you can connect. That's one change you can make. The other is if you look at your weekend and you don't have a plan to do something enjoyable, you're going to leave at the other end of it depleted. Find a way to think about. So in my family, we're thinking, what are we going to cook and eat? We're looking at new food, special something to look forward to give us a sense of pleasure. I looked at my Thanksgiving, and I have a sister who missed the Italian cooking gene. And she can't cook, my sister Dee Dee, and she'll tell you that. She'll tell you that too. So her family, because I did get the Italian cooking gene, I don't know how that happened, but her family comes to my house for the holidays and other times during the year because they have to get fed a couple of times a year. Well, right, so I do that for them. But I said, I'm old, you're old. My kid's going to school. You're young. You're young, grown up now. Woman is teaching school, right? We really should not congregate at Thanksgiving. But what I'd like to do is cook the turkey and cook the stuff, and I'll put it in a box and I'll bring it to your house Thursday morning. And the things that you can cook, like she stuffs celery like my mother used to do with cream cheese, a very nice tradition in my family. I said, you do the stuffed celery, Dee Dee, and I'll cook the stuffing and the vegetables and the turkey like I usually do. But I'm going to bring them over because I don't want to miss that. I don't want to say, let's just not do that, right? So enjoyable activities, intentionality, got to plan it, got to negotiate it. Third thing, and I'll remind you that there's a ton of popular as well as more serious research out there about cognitive therapy, right? You want to think about the thoughts that come to your mind. So a bad thing happens, how are you evaluating it? How are you appraising it? What's the logic that you're looking? Is it accurate? Is it the only explanation? If we've learned nothing in the last several years, and especially in the last year, it's to check the facts, right? Because what we see is that what gets presented as truth not only influences your thinking, it influences your feeling and it influences your behavior. If you think and feel that something is true, doesn't matter whether it's true or not, you're gonna behave in a certain way based on that data. Human beings are like that, right? Human beings are like that. But the good news is human beings can edit that. We can relearn that. We can change it. We don't have to be brainwashed by that. We can reevaluate that. But again, like the dogs, you got to do the work at it. This is not an easy process. You can't wish for it to happen. You can't think, well, I'm a healthy person, I'm going to be fine. I'll remind you again, 40%, probably an underestimate, of Americans now are experiencing depression and anxiety because we're in a learned helplessness experience on multiple levels, and we're appraising it negatively, and we're not doing the intentional work of seeking relationships, finding pleasures, and changing the way that we think, all right? But this is the puppy show this morning, but there are nice sources of pleasure we can find. There are ways we can think. There are things that we can do. And as a community, we not only have to, since we're a community, we not only have to do that for ourselves, we have to help each other with that, because there are folks that are not sitting with this kind of information. We need to share that information with them. This is, not to sound like Psychology Today or some simplistic article you'd read in the U.S. News and World Report. This stuff does have a scientific basis, right? We're sick because of good reasons, right? The science is there that shows us how these experiments can create low mood, but the science also tells us how we can get better, right? And we need to be able to do that. So find a puppy, right? Pat the puppy, put the puppy on your lap, right? Spend some time, get a nice cup of coffee, right? Little things, big things, complex things, all right? So I think we've got time. We can talk a little bit together. I'll stop my sharing. That was useful.
Thank you very much, Nick. That was really, I actually was taking pictures and I texted a couple of the slides to my husband. So there may be some immediate positive out of that. What I loved about the CBT part as well is the way you described it, which was helpful, but also it wasn't, don't identify the emotions. Because I think that some of the unhealthy coping that I see around is denying that all this is going on. So, right, it's sort of back to what you were talking about with I'm just tired and all I really need is a night's sleep. Well, you probably do need a night's sleep. And is that something underlying that there's something more than that? And I think that as a society, I think we sometimes celebrate ways of hiding these things or pushing them away or using, coping, have a glass of wine, don't think about it, those kinds of things. And in the short term, that might help, but over the long term, it's only going to make things worse. So I really appreciated the way that you got underneath that.
Like lights in your house, right? If you don't do the investigation, if you don't look, eventually your house falls down. right? So really important to do the analysis and to seek an intervention, right? But God built us to be able to do that, right? God didn't just build us to be reactive to our environment. We've got capacity and we need to use it.
Absolutely. Thank you so much. I really appreciated that. And as I said, I was taking notes. So I would like to open it up to questions. I think Sam Sherman, myself, and Dr. Covino would all be happy to answer any questions that anybody has or any comments. So I'm trying to work this, but I see Shauna has her hand up. So not that I'm rewarding the fact that she didn't use the technology, but I will let her get in on a question.
I was trying to find it. I forgot how to raise my hand with the technology. Nick, first and foremost, thank you. That was fabulous. And from a personal experience, I've had a sister who's been on lithium since 1975, diagnosed as a manic depressant. I would love to know, because I operate a pub in your neighborhood, real close to your college. I would love to know what would be your wish or call to action from the community. How can we help and support your efforts? I am so proud that you're in our neighborhood, and your college has grown so crazy to me in the last 3 years. And I hear such wonderful things. But I would love to know what I can do to support your effort, and what would be your call to action.
So we're growing sane, not crazy, Donna. But so we're looking for happy hour to come back to the pub with chicken wings and beer, right? So we're looking. One thing that you could do, not just for my students, but for the faculty, chicken wings and beer, that would be great to have.
Well, Nick, but I would say, though, that when Sam and you said it in the beginning, why is there not a Jimmy Fund? And we always kid about it and BID about the SAMF and the SAMs. I mean, I immediately thought, why don't we have a Samantha or a Sam's Fund, an initiative to do something like that? Because I've grown up in the last 45 years of dealing with the fact that this is something that people just push aside and nobody wants to do anything about it. And I think that we really need a call to action. And I think Sam Trotman is probably about that person that could get that going.
I quite agree. So there are multiple things we can do, right, together. The most important thing is we can understand that this is an issue like heart disease, no different. No stigma, no inhibition, no shame. Though I got to tell you, when I told my brother's story, I didn't even tell my own story, right? But I told my story in a group of 1,000 people because I wanted people to understand that even a person who ran mental health, who's taught, I don't know how many people I've taught that are psychiatrists and social workers and psychologists, probably in the hundreds now in my career. I could never find treatment for my nephew. And I felt terribly guilty when he killed himself, terribly guilty when he killed himself. That's my brother's story, right? I'm not, the level of shame in that, not so high, right? Easier to tell a story about someone else than yourself. Tell your own story, right? What Samantha does is she normalizes this for people and said, look, I'm a normal mom. Not only am I a normal mom, she's a super normal mom, right? She's an accomplished businesswoman. She's done bright and bold things, right? So share your story and listen to the stories that people share. That's really important. We have to normalize this, right? Second thing is we've got to look for ways to teach about it. So I gave you some stuff. There's I don't even need to give you a reading list. You can Google something about any of these things I talked about this morning. I'm happy to share the slides with people if Samantha, that helps you. I'm happy to deposit those slides with you. Go find out something to read. Read a book about this. Read a book about this, right? And understand what Seligman's experiments were about. Understand the importance of attachment and relationship. Understand the importance of pleasant events and teach about that. That you don't need a PhD to be able to do that. So share information, share your own information, right? And then look for ways to get active. You know, you're right. We're doing a lot of stuff and now we're in a space. So when I came here 18 years ago, we were a little tiny one department place that should have been a department in someone's university, right? and we were broke. we're going broke. We grew because the work we do is necessary. We grew because as we started to look for the need and we created programming, people came. We built it like the Field of Dreams here, and people came. We're now a $35 million business. We were a $2 million failing business. But we, look for ways to be supportive. Come to the things we offer for educational events. If you're able to send money to help support the building up of a diverse workforce, we're doing what no place in the country is doing with Black mental health and Asian mental health and military mental health. And those kids need help getting through school. So if there's ways that you think that you could advance that, please do that too. But we're all citizens of this experience, right, of healthcare. And again, when you think, it's not just a service to somebody else, this is coming to your house, right? It may not be there yet, but it will come to your house. And you want to have providers able to treat it, help it. You want to have wisdom and knowledge and folks to collaborate with. So I think the biggest thing we could do is own this issue. We all need to own this issue. This is not someone else's family. This is our stuff, right? This is our neighborhood. This is our mom, it's our dad, it's our spouse, it's our kid, it's our neighbor, right? All of this is real.
Thank you for that. I did notice, I want to reward Jana for using the Zoom hand raise. So Jana, please.
Thank you, Samantha. I tried working at it. So Nick, thank you so much. So I work at a school as well, at a graduate school. And if I think about, and I have kids, so I think about the long-term, yes, we need more professionals in the field, but it's a long-term solution. And I think about the way our kids like to communicate and get information and support. It's a very different mode than what we have. So I brought in a group to talk to my university about like Talkspace and the texting stuff. And there were some serious shaking heads. They're like, wait, the person doesn't respond immediately? We're like, no, it's a text, and then there's a pause, and then the person texts back at a certain time of day. Like it's just a very different model. Do you have any sense of the efficacy of those models? Are they helpful? If I think about the way to scale up quickly, that gives me a little hope, and I just don't know how effective they are.
So I'm part of this ACUM group, which is the Association of Independent College Presidents. So I sit with your college president, if it's Larry, and other folks in that space. And they ask, because I'm in the meeting of all these squares, what are we going to do about mental health? Their model is, let's put 5 more people in the counseling center. And I say, that's $500,000. It may be 7, and they'll see 20 extra kids, right? So that's not the way to do it. What's the way to do it? Take your faculty, gather them together, and say, if people have a problem with isolation, don't talk with them like I was trained to teach as the wise person at the head of the class. Form groups. Give them tasks where they have to collaborate. Make connections for them. Take 5 minutes and ask how people are doing before you move forward with your class. Ask folks to exchange text, email, or telephone numbers with each other so there's connectivity in the space. Offer yourself for that 25% of folks that are suicidal in your classroom, even at Harvard, and say, if you get in trouble, I'm your guy, I'm here. I may not be a trained mental health professional, but I want you to know that if you get jammed up in some way, here's my cell phone. I'm ready for this, right? So I'm of the opinion that the same work we do about social emotional learning in K-12 and try to help K-12 people create responsive learning environments that are culturally fair-based, supportive, and inclusive, and emotionally supportive for kids. We need to do that in college, and we don't. And so we're beginning, I have a meeting after this meeting with the ACUM folks to say, I need a grant. I need them to help me find a grant so that we can begin to do this kind of information sharing. And I don't need the cynical faculty that thinks that the thing that they're speaking about is the most important thing to get a young person in front of and the only thing that they should hear. I need the folks that think, I got kids here with me that look like my kids that I'm raising or I've raised, And my job is to help them, because 5 more people in the counseling service isn't going to work. And in your space, Paul Barrera, who was your medical director, is an old friend of, not an old, we're both, we got to learn how to do that differently, me and Paul. But he was a Jesuit with me when we were very young, right? So he and I trained together for 8 years. He'll tell you, if you know him, that he was my angel. He was my orienter. But he's a local expert in that space,
Yeah.
Paul, and has really taken this seriously. He's a psychiatrist that was the medical director at Harvard, but he's done some good work thinking about how do we do this in a different way. So we need to basically deputize, right? It's like, bad stuff is happening. What are you gonna do? Hire another sheriff? Well, you can't hire another sheriff. You deputize the whole town and you say, look, everybody take a piece of this on. And if everybody took a piece of this on, things would change, things would improve. But it's not going to improve if we don't do it. It needs intentionality and effort, and probably funding. So if you know a big, huge funder that wants to fund the project, we're looking to do that at ACUM and bring that forward.
Okay.
But that's a message that the K-12 faculty have gotten, but college faculty not so much. And 25%, again, I'm telling, 25% of kids in college have thought about suicide recently. That's some serious stuff.
That's some serious stuff.
Yeah, I couldn't agree more, Nick. And I have at least one neighbor on the phone, and they know that we've had some tragedy in our neighborhood. And, you know, I've thought about things like as simple as what we used to call the neighborhood watch, which was watching out for robbers. And I'd love a way of saying, it's not the neighborhood watch about robbers, it's neighborhood watches. Are you doing okay? Are you struggling at any level? And is there any way that we can help as a neighborhood? Because I think we've sort of stopped doing that as well for some reason. Yeah, I love the idea of deputizing the whole neighborhood. I like that.
And I don't mean to dumb this down, but part of why I wanted to present it the way that I did was to say, first of all, there is a science to this, right? These experiments have controlled, replicable, randomized designs behind them. So there's a science behind this, but Catherine will tell you the same thing as I will tell you, right? You don't need a PhD or an MD or an MSW or an MPH to do this work. This is not rocket science, right? This is accessible human information that we could share with each other, and we can implement in places where we work and we live and we congregate. So we can read about this. It does not take a long time to get up to speed on what this is about. And if you would like to put something together that gives us some readings in that space, I don't have them handy, but we'll put the Samanthas together, and maybe I'll give you one of my graduate students and we can build a resource page at the hospital for you, if that could work. But I want to say again, you know, if your name's Virginia or Alejandro, you can do this. You do not have to go to graduate school to learn how to do this. But if you're interested in graduate school, I happen to know one. And so we'll be happy to take you if you want to study it seriously. All right, so good.
Thank you so much. I did want to just recognize that we do have the director of psychiatry at BID Needham on the line, Danny Mendoza. So I did want so he actually is qualified. Thank you for joining us.
So he is qualified to do this. So thank you.
I'm not sure my wife would agree with that, but
Okay. Well, thank you.
That it's nice to meet you. She would agree with that, Danny. She would agree with that.
Nick, thank you so much for that very nice outline. But this is in fact a major crisis, and thanks for inviting me to join this forum. I got called in by John Fogarty probably a couple of years ago to potentially look at starting a consultation liaison service at Needham. I've started services at Plymouth and at Milton. And at that time, Greg McSweeney told me that there's probably 1 or 2 patients a week, and mostly in a geriatric age because of the nursing homes. And I did tell him, if you build it, they will come.
Yeah.
So along the way, we got caught in this merger with BI Leahy. So I'm involved at the system level as we try to build collaborative care programs in the 85 and growing number of primary care practices across the system. But right now, with the demise of Norwood, the population at Needham has changed dramatically, and I think we're trying to implement as best as we can. And I'm putting things on the table for this group. Your population has changed dramatically. You still have your elderly patient who comes in with a COPD exacerbation and pneumonia, who is suddenly using words you've never heard her use before. That's a delirium, very common. We can help with that. But you're also going to see patients with delirium tremens from alcohol withdrawal, people with opioid use disorders that we never saw before. And, I'm also a psycho-oncologist at the Dana-Farber. You're going to see people who not only are dealing with the impact of cancer and cancer treatment, but also the impact of being isolated from their families because of the pandemic. So there are multiple things that we can do. And one of the things I was thinking about is we had started a program called Preventure for the school system in Plymouth. And Preventure is an evidence-based practice that was started by Patricia Conrad in Montreal. And it's been utilized in the UK, in Australia, in New Zealand, and at the 7th and 8th grade level. It's the only evidence-based program that's endorsed by SAMHSA that has both a primary and secondary preventive model attached to it. So we're into year 3, and we identify kids that have 4 risk factors from a personality standpoint. And those kids, if their parents agree, would be enrolled in a cognitive behavioral therapy approach. And this has had a profound impact. The challenge here is how do we spread the word? How do we scale this? Because I think that's where we can have the most impact on this population.
So I've not met you, and I'm sorry for that, though. We can fix that. If your wife agrees, we can fix that. We'll find a way. But I know you're a school superintendent in Needham. He's been part of a group of leaders that I've worked with for the last number of years. We've got a piece of William James that is Teachers 21, does consulting and work with school superintendents, principals, and teachers. There's money, there's funding for things like that in the community. There's certainly funding for primary care work or for integrative mental health work, as you know very well. And, I've got 800 students here that need to be in training spaces. And so we've got opportunities to do something serious if we're looking. And for many years with Jeff Levine at the Beth Israel, I did your kind of work with consultation liaison work. So we've got, even with me, but we've got other folks that are smarter than I am that can come and think with you about how we can collaborate. I'd be eager to do work like that. And if you get moving, I can promise your faculty and folks to help you think. And then maybe we can do HRSA or SAMHSA both to do training money and also intervention money for projects like that, and especially projects like that for kids. So either of the SAMs know how to find me.
Yeah.
And we
We'll
can
definitely put you in touch. And this is
Nick,
precisely
so I'm sorry, Sam. I appreciate that, Nick, but I also wanted to reach out to the board members. When I asked Patricia Conrad what made it so difficult to get this off the ground, because we were the first hospital system in the country to start it. What she said was it was pushback from the parents.
Yeah.
And
stigma.
Right. Yes, the stigma. So I'm glad that you know the superintendent. Gary is fantastic, and he decided to put it no matter what, and We hit a few landmines along the way, but it's moving into the third year. But wouldn't it be great if we have a system-wide approach to this from at least a BI standpoint? I can tell you that Bill Greenberg had met Patricia Conrad and was very impressed with her. And so that's one thing. The other thing is that, Nick, do you remember John Levine?
Yeah, so which John Levine? There was a young
So
one.
John Levine was a psychologist at the BI for 20 years, then went to medical school and is now a psychiatrist.
He was my student, and he'll tell you the story about when he told me he was going to medical school. I took him for a walk and I told him, don't even think about doing that. But then he went ahead and did. So I know him very, very well. He's a brilliant guy.
He's a terrific guy. And the reason I want to bring that John Levine up is John is the medical director of MBHP. And the backstory is that 30 years ago, and Nick would probably confirm this, the state decided brilliantly that they would carve out behavioral health and have outside agencies manage behavioral health to cut down the cost. So we have a cottage industry built over 30 years where there's a stratification of care depending on your insurance. So we've gone the opposite way. This is not mental health parity. So if you have commercial insurance, not a problem, easy to get evaluated in the emergency department or on the floors, because you can make your own determination. I can make the determination that you need more care. But if it's a patient with mass health or is uninsured, even if I feel the patient needs to be admitted to the psychiatric unit, the emergency service provider would have to come in and see if my opinion matters. And this would typically be just a master's level clinician. So the reason I'm saying this is John Levine, as director, is interested in a pilot that I'm trying to put together to run the evaluations of all the BI community hospitals as one. There's going to be a significant pushback because, as you can imagine, the emergency service providers will say no because they're going to lose a lot of money. But
yes, so Danny, I think this is like a really, really beautiful big topic, and I warned Nick that if I asked him to speak today, this was just the beginning, because this is what, as chair of advisors now, this is what I want people to be thinking about. And so I would love to, I'm just sensitive to people's time because we're running a little over time. But I would love to reconvene this, maybe even a smaller, passionate group. And I think there's a lot to be done here. And I have, as a user of some of those services that you just talked about, and also as a parent that has witnessed intervention at the school system level where friends of mine have said, how dare you suggest that my child has mental health issues, and the pushback from the parents I've seen in person as well. I think there's a lot that we can work on together. So I'm excited about that.
Thank you.
I did want, being sensitive to everybody's timing, I did want to let people go if they need to, although I think that, Nick, are you okay to stick around for a few more minutes for more questions?
In about 5, so I can give us 5.
Because I know we have at least one more question. I do want to, before we lose people, just remind everybody of the Stronger Together virtual gala this year for BID Needham. It's on November 7th from 6 to 6:30 p.m. It's a great way to get to know the hospital if you don't know it already. If you do, it's a good way to learn and perhaps donate some funding to frontline staff and our Heroes Fund, which benefits our frontline workers. And it's a great way for other people to share and you don't even have to get dressed up and leave the house to see it. So if you need more information on that, just email Samantha, either of the Samanthas. And then I know, Kip, you were patiently waiting with a question there, please.
Yeah, no, Sam, I just wanted to thank you. I am your neighbor and lost my son 2 years ago. So, Nick, I think that this sharing our story is so critical. And there is such stigma. And I feel so passionate about what you said. So thank you. And I think there's so much room as we do share our stories to transmute the lower energy to higher frequency of, from hopelessness to hope and joy and appreciation. But it does take a village. And I think that my own experience sometimes is that people don't know what to say, so they don't say anything. And I just invite all of you, if there's pain in people around you and in their life, that you don't shy away from them and you move towards them and we lean in. And I'm just very appreciative of this dialogue. And it's actually what the Hollister Institute's all about, right? It's real conversation. So that in business, even now, we need to lean into the emotions because we're forced into this emotional management space. And there are a lot of leaders that are uncomfortable with it. And so we must model it. We must model this behavior and be it ourselves so that we can be a shared humanity. That's all I had to say. And thank you, Sam, for inviting me.
Yeah, so that's not an all, right? So people, as they hear of your loss, and I'm sorry, get touched by that very powerfully. And so it'll be on people's minds. I mean, I watch my brother come play basketball with my son, and my heart breaks. He's thinking about his Nicholas and not being there. And you're quite right. Nobody knows what to say, because what do you say? I mean,
The worst nightmare, right?
there are incalculable losses. There are incalculable losses that live with you for all your life. And the best you do is you find a place for that, right, personally. And then as you can share with others and tell others and make them feel more comfortable in a space. And if there's a story that has prevention or intervention or something people could learn and do, and you're not afraid to tell that because of your grief, that's enormously heroic, Kip. And it's what we can do as a community. And my hope, I expect, there are people who love you that connect back and find some way to just be. But it's really it's the hardest. I could not imagine it. When I see my brother, I get this one little midlife crisis that I had.
Yeah.
I can't imagine. But thank you for bringing that.
Yes.
Guys, I gotta go because I've got something at 10 o'clock. I gotta even prepare.
You just blame the two Sams. Just say it was the Sam's fault that I'm late. Okay.
Some people will let me get away with that. This meeting will not let me get away with that. I'm gonna blame Danny is what I'm gonna do and send him to his wife and tell his wife on him, right? All right. And so thank you all for your attention and your engagement. I'm happy to come back. You guys are not that far. I'm now starting to get my orthopedic care in Needham, and you guys are and on time and accessible. And though I miss going to 330 Brookline Avenue because I did it for 20 years, I'm happy to find Needham. It's a much easier place. All right. Thank you, folks, very much. And
Thank you, Nick.
Nick, thanks so much.
Bye-bye.
Does anybody else want, by the way, Kip, if you're still on, that was beautiful. I think she dropped off. Thank you so much. This was a wonderful way to start the day or continue the day. And does anybody have any other comments before we close? Thank you so much for being here. Obviously, a very important topic. I thought it was a great discussion and to be continued. Have a wonderful day. Thank you.
Thank you, Sam.